Hi, my name is John Faulkner. I am the host of the Smarter Systems Better Care podcast, and I'm here today with Dr. Joshua Tamayo Sarver. He's an emergency physician, innovation executive, and recognized authority in the healthcare technology and digital health space. He is currently serving as the VP of Innovation in Inflect Health and Vituity. Thank you for joining us today, Dr. Tamayo Sarver. How are you?
I'm doing great. Thanks, John, for having me. I
You're
look forward to the
welcome.
talk.
Absolutely. We'll just get right into it. What are some of the major shifts that you're seeing in your industry right now? Interested to hear more.
Yeah, I think it's actually a cool question because there's so many different shifts going on that it's a little bit dizzying. And so in the technology space, we have all the potential for AI and how generative AI, I think it's so cool and there's so many things that it can do and people are running around figuring out what it can do well and what it can't
Yeah.
do well. I think ultimately we're going to find that what it can do well is a very narrow subset of what we're trying to have it do right now, but it can do it in better ways than we think. And I think it's actually more transformative than we realize, that narrow subset. And we can talk more about what that I think that is. At
Absolutely.
the same time that we're having, this regulatory flux where it's a lot easier to play around with things because of all the deregulation, and then it's a lot harder to actually do anything with them because of the deregulation,
Yeah.
right? So I
Yeah.
think it's a double-edged sword. That's been kind of interesting. And then I think during this last election cycle, we saw the rise of individual contributors, Elon Musk donating millions and millions of dollars, which has been relatively disempowering to the previously entrenched political influencers like the insurance companies or pharmaceutical companies. And so I think that's creating some really interesting regulatory and societal shifts in how we view those things.
Absolutely. And you mentioned ethical considerations. That definitely a hot topic of people adopting these, new tools that are out there. Generative AI is the hot topic, but I feel like a lot of people just don't understand it. Sometimes you might just take that information and copy and paste, and then you're done. What's your kind of take on that? How can people vet that information better to make it more worthwhile to use?
Yeah, and I think part of the problem is just there's a lot of whining.
Yeah.
And I don't actually mean on the part of people. I actually think we as technologists are doing ourselves a disservice because what happens is we create a generative tool. And I actually think that we should be treating AI and just like we do any other health technology. And I think the more we treat health technology like any other medical device, the better off we are. And what I mean by that is, if I get a troponin on you, which is a blood test to check to see if your heart's muscle has had any damage, right? I don't know what's happening at a molecular level with that troponin test, right? I don't know what the actual lab scientists did at the bench to create the test. I don't know what the FDA derivation study looked like or validation study. But I do know that the FDA has said that under these indications, the test performs like this in my patient population, and this is when and how I can use it. And there's real world evidence to support that, and then ongoing post market monitoring, right? So, how the soup is made, right? Like, I don't really know, but exactly how and when I can use that soup and that it's safe to use in these circumstances, I can rely on. And if I don't, if I do it incorrectly, then it's on me. But if I do it correctly and there's a problem, then the lab, the makers of the test, are equally accountable, right? They have to be morally, ethically, and legally accountable for that. I think we need to do the same thing with the devices, and the reason is, or devices meaning health technology and AI. And the reason is if you're giving me a test and saying, "Hey, this is great AI, you can use it," and then I say, "Okay, well, if it's wrong, are you going to tell the family the death notification, say, sorry, we accidentally killed your daughter?" And
Mhm.
you're like, "Oh, no, no, you're still the doctor. It's still on you." And I'm like, "Okay, so it's still on me. So when can I really rely on it?" And you're like, "Well, always use your judgment. You can't completely, rely on that." And I'm like, "Okay, so why am I paying attention to it? Why are you giving it to me at all?" And then I don't adopt it. And then as a technologist, you go, "Oh, doctors don't like technology." And it's like, maybe we just don't like backseat drivers, right? So I think the more we treat the technology and don't worry about this whole transparency of, instead of showing you how well this works, I'm just going to show you how smart I am and how well I made the technology, right? That kind of like seems what the transparency thing is. Instead, let's just say, okay, we're going to hold you to the same standard that we hold every other medical test and diagnostic to, which is you need robust real world evidence, the indications for use, true sensitivity and specificity and test characteristics, and engage in that level of discussion rather than this is really cool technology, but you're on your own.
Yeah, taking it through the same standards that we apply to medical devices or decision making tools. It sounds like kind of what you're alluding to get it through the process. So
Yeah, and most decision making tools don't go through that process, right? They just kind of do the flimsy, hey, it worked in this population, but we're not going to be regulated because doctor, it's still on you.
Right.
And then they get really, really low physician adoption, right? We have over 6,000, 7,000 clinicians. We see 12 million patients a year. And if I roll those things out to my doctors and say, hey, this is great, it's the best thing since sliced bread. Now that I've told you that, you can't actually rely on it. It's up to you. And if you do rely on it and something bad happens, it's all on you.
Yeah. It's
Right?
too
Like,
much. It's too one-sided, right?
yeah.
It's to be
And
partnership, understanding like there will be errors and we can work together there to fix them, but we're not going to like cast all this blame on one side or the other. Like let's work together to make this better to see what we can use it for.
right. And we stand behind it. We're willing to be accountable for the recommendations we make.
Absolutely. And then how have you seen like these trends that we're discussing kind of like impact your own business and growth strategy? Curious to hear that perspective.
Yeah. So how do I say it? So to me, we were talking about generative AI, and I
Yeah.
was mentioning that I think there's a subset of what it can be used for that is incredibly powerful, but much more limited. And because generative AI is probabilistic, we've deployed it a few times now in ways where it needs to have zero hallucinations. Well, generative AI can't have zero hallucinations, so we end up having to put technology around it, and it's usually old technologies that help make sure that the final product that the user interacts with doesn't have any hallucinations. Because without that, you can't rely on it, right? And as a maker of technology, I can't stand behind something that goes off the rails, right? Like it's on me. The onus is on me to make sure that it has zero hallucinations at the end. And for that reason, I don't know that we're going to see things where generative AI as a standalone technology is going to be appropriate for very many healthcare settings at all, right? Because of that limitation. But what it can do is, and I remember, because I'm old, I remember when I learned to program in MS-DOS, and I was like, oh my gosh, I have unlocked a secret world for how to talk to computers. And all these old people, because, I was young, all these adults around me, they have no idea how to talk to computers. And suddenly I'm like, all the adults are coming to me to learn how to do this, right? It was so like empowering, and I felt so powerful because I knew how to use MS-DOS. And then they went and invented the mouse, man. And I had this graphic user interface, and I was much, much less special all of a sudden, right? Because the stupid grown-ups, even they could learn how to use the mouse and interact with the computer now,
Yeah,
right?
exactly. Yeah.
I think generative AI is kind of the same thing, right? We have self-serve analytics, and the way that you do self-serve analytics and the way that you create those tables and the data and you prepare it, we've got great solutions to that. It's just hard to interact with them, right?
Yes.
It's not the capability of the computer that's the limitation. It's the capability of interacting with the computer, right? You need an engineer, you need a data scientist to program that. To me, the big unlock of generative AI is kind of like that, the next level of that graphic user interface was, right? So what does that mean for healthcare? So I can now, I just worked 3 night shifts, which is why I'm a little bit crispy. And on each of those, I was able to use generative AI to do my charts for me, right? And you're like, oh, okay, well, that's a cute little thing, right? Where you don't have to document. But because I'm interacting with the AI, it's really easy for me to, one patient I was concerned about hantavirus. So the AI documentation tool that I have also hooks up into all the guidelines, but it knows everything about the patient. So instead of now sitting down and going to one of the big resources, even the AI resources, to say, okay, let me tell you all about this patient and then tell me what the treatment is, right? Let me look up best practices. Well, this ambient just listened to the entire conversation. All I have to do now is say, this seems like it could be hantavirus. What are the tests that I sent for that, right? And it spits it all back out for me. Now, I have to check that against the guidelines, which it provides links and such to. But the point is because that interface is now with me, all that friction that used to exist to look up tests is gone. And you take that another step further. Because that interface is with me at the time, the tool that we have tells me my billing and coding. It identifies the high risk aspects of things and says, hey, you might want to think about this. But in the setting of doing my documentation, so as a user, I get incredible value from using it. It's like we always say, you have to get someone to come to your party before you can tell them what games to play. Generative AI is a great way to get people to the party. And then it makes it really frictionless and like just a natural human workflow to get all the games you want them to play in.
Yeah, that's a wonderful analogy to it. Talking about, making it more of a simultaneous process with kind of like how all your own human thinking is occurring as a physician, as you're evaluating a patient, things that are occurring technology wise with ambient technology, which is amazing right now. There's talking about billing codes connecting now on like the future, and they may be already doing that in some of those technologies, which is great. So as far as like kind of getting back in your own business too, like what's working well for you right now, and like what's been frustrating to deal with like in the day to day? Curious to hear that perspective.
Yeah. So the parts that are working well is I think we've gotten over the past 20 years at doing this, I think we've gotten really good at going from ideation to having what we call a real idea, right? So like if I say, hey, let's go on vacation, that's my great idea. I would call that a notion maybe, right? Like it's not specified enough. So once you get to the point where you say, okay, we've validated the problem space, we've validated that's a problem for a customer. We validated that that customer is frustrated with that problem. Because if I tell you you have a problem, but you're not frustrated by it, you're not going to change your behavior. So I could give you a
Right.
solution, but you're not going to use it. So,
Right.
we need to make sure that we identify a problem and that the user, the target, is frustrated by something that would get them to use a product, right, that addresses that problem. So we've gone through that validation. We've done willingness to pay. We've done it so that we now have a really like here's a roadmap that we truly understand this problem space, what the go-to-market's going to look like, what the channels are, and how we think it's going to work, right? But we've
Yeah.
at least validated with prototypes.
Yeah.
We've gotten really good at going from ideation to that pretty thoroughly and quickly. That's the part that's going well.
Excellent.
The part that we're working on is figuring out how to go from there to scale more quickly than we do now. And we've gone a few times, we're getting quicker at it. And a lot of the problems that we run into with that is actually I remember when doing a POC used to be really hard, right? Like you remember all the,
Proof
back,
of concept.
yeah, doing the proof of concept, you'd sit at the computer, your team, you'd do so many engineering things. And then like the first time it works, it's like magical. And then it doesn't work again for like 5 days, right?
Yeah.
You can't get another
Or 3
thing to
months.
work. Yeah. It works through once and that's it.
Yep.
And now with generative AI, it's like it takes, a couple hours and a couple beers and you have something that kind of works, right? You put a wrapper around something and it kind of works. And so it's hard to know when to be excited because going from kind of works to I can scale this is so incredibly difficult because you have to figure out what are all the technologies I can put around this so that I'll get back to zero hallucinations and it's going to do the same thing right every time.
Yeah. And I heard you use hallucinations before. For the people on the listening, what is a hallucination in the generative AI space, just so people understand that more?
Yeah. So first off, it's a terrible word for me to use because it's anthropomorphizing math, right? So I'm thinking, so the way generative AI works is it's probabilistic, right? And it looks at the words and it turns them into little tokens. It makes a matrix out of it, right? And it points to what it seems going to be next and it kind of generates that. And when it's doing that, because it's probabilistic, it's like, when you see the words vice president, the next word likely is going to be JD Vance.
Yeah.
Right. And sometimes it'll say vice president and the next word is that it comes up with is Dan Quayle. Right.
Yeah.
Or it comes up with, Trump. Right. And so because it's probabilistic, it makes it so incredibly powerful in a language sense. But it also means that it's going to recognize a pattern and provide a result to that pattern that is not what we're expecting or desiring as the output. Right.
Right. Yeah.
And we call that a hallucination. And we call it a hallucination because it's using language. So we think of it as a human actor, even though it is just math. And so that's where the terrible slippery slope of anthropomorphizing it comes in.
I like that explanation. That makes a lot of sense because your inputs may not match the outputs necessarily. Like you said, if you're asking about the vice president, generative AI might not know your reference point. Are you talking about the VP from 50 years ago? Or are you talking about the VP for now? So you have to really think about your inputs in the process. So, yeah.
Yeah. And the reason why people do fine tuning, people do a ton of things to try and get rid of hallucinations. We've done so many different things to try to eliminate it from working that way. And it doesn't, and it won't because it's not a bug, it's a feature, right? That's the way it's designed to work.
Yeah.
And so you need to figure out other ways to detect when it has had a hallucination or when it has misrecognized the pattern and ask it to recognize it again or change the way the question's asked.
Absolutely. It helps you learn how to work with it, like where it's at right now, right? So
yeah. Well, and honestly, a lot of the problems that we run into with it are problems that we've solved with computers long ago. We just suddenly forgot that we already solved them.
Yeah, exactly.
Really.
Yeah.
So for example, we for that same ambient documentation tool, it does its own own coding, right? So it figures out the diagnosis. And a lot of times, say, diagnosis, chest pain of unclear etiology, right? And we wanted it to pull the ICD-10 code. Well, it turns out that if you ask generative AI to pull codes for you, it does a really bad job, right? It's really good at identifying that I told it the diagnosis was chest pain of unclear etiology. But then when you ask it to pull that actual ICD-10 code, thinking back to the way it works, it recognizes a pattern, and then it goes and looks for what ICD-10 codes are associated with it, and it pulls one of them. Well, I don't want it to pull one of them. I want it to pull the one.
Yes. Because
But
there's
it also turns
100
out,
variations of the same code, right?
yeah, and I don't want those minor variations. I want the exact one. And it turns out that 30 years ago, 40 years ago, 50 years ago, we figured out how to use lookup tables.
Yep. Yeah.
And so we discovered that we could just actually have the generative AI identify the language of chest pain unclear etiology, and then just use good old fashioned lookup table code search query to look up what the ICD-10 is that matches with that specific word.
Yeah, that's a great realization too, is like we kind of forget where things started and where they came from. Some of the ideas are now like new ideas, but other ones are we just forgot about them in our history, technology. So it's interesting you brought that up. And then kind of diving more in like the current state, like what are like metrics you are looking at specifically? Like how do you measure success?
Yeah, so I think the most important success metric is the quality of care that's delivered, right? Like we're in the healthcare business, so our business is taking care of patients. And so the question is did we take care of the patient well? And so the first metrics we start with are the medical outcomes. And then, when I'm going to the doctor or interacting with an online service, what I'm looking to do is generally feel better in some way. And so part of that outcome is, do you feel better? Right? Like you were trying to achieve something. Did you achieve it? And so I think those are our first metrics is, is the medical care, was the outcome what we wanted? The second is it what the patient wanted? And then you get into the process measures of, did we meet quality metrics along the way there? Did our providers, are they still happy that they're a provider, that they're a nurse or a doctor or a PA or an NP, right? Are they finding meaning back in their job again?
Yeah, reducing that burden, that's the big topic nowadays, provider burden. That's the discussion everywhere right now, trying to make that better.
Yeah. And honestly, that's why for Vituity, which is a large physician group, you're like, well, why do they do all this stuff with innovation? And it's kind of like we're so tired of getting served terrible meals for so long. We said, okay, I think we need to get back in the kitchen and help with the cooking, because at the end of the day, I have to eat my own dog food.
Yeah. You have to experience it. You're saying in the way, like if you're preaching it, you're building it, it's all going to come back to you in some shape or form. So,
well, I'm on a shift, I'm going to use it, and it either makes my life better or not. And we've kind of discovered, we feel if we're not at that table, if we're not there helping to guide it, then it's not going to be made to make our lives better.
Absolutely.
And it's just another burden and another source of burnout.
Yeah. And then like just thinking down the road, future goals, where you want to be. So where do you want to be like in 6 to 12 months? Like what would be like your measurement of success and where you want to go?
Yeah. So we have a few more tools that are coming out that I want to make sure they're successful and are making the world just a little bit better. And for patients and for my providers. The second is we're establishing a lot of relationships with some centers around the country, so that, what we're, I think, particularly good at is figuring out how to scale healthcare technologies rapidly and broadly. And the reason being, we're in over 650 different hospitals. We have outpatient centers. We're full stack billing, malpractice. We own it all. Because we have that view, it allows us to say, okay, you just designed this incredible technology at this one amazing innovation center, but that's not the way medicine is practiced across the street, or certainly across the street or across the country. And it's really hard for someone on the creation side to create something that solves that broad a problem if they don't have line of sight into all the different healthcare settings. Because we have line of sight into all those different healthcare settings, it makes it a lot easier for us to work with someone so that their technology is designed in a way that makes it scale much more rapidly, efficiently, and safely. So I'm really excited about the partnerships that we're creating with different centers around the country to try and bring what we're good at, which is that scaling, with what they're good at, which is, a lot of the really cutting edge, cool stuff. and seeing if we can accelerate this healthcare creation and adoption cycle.
Yeah, speed it up for sure. And then if I always like to ask this question, if you're a wizard, you had a magic wand, what's one major challenge you would love to solve right now in your business?
I think the major challenge I would love to solve would be to try to realign healthcare to the patient. Their current healthcare system, it functions as designed. It's just not designed for the patient, and it's not designed for the provider. It's not designed for the person needing help, and it's not designed for any of the people helping that person. And so you end up with all this unhappiness and dissatisfaction and an incredible amount of wasted dollars. And how do you fix that? I don't really have the answer to it.
It's
But the magic wand would be great.
Yeah, a magic wand would be great, because then you wouldn't. Yeah, I feel like it's definitely a barrier that everyone's trying to solve, and I think at least my answer would be it's faceted. There's many different pieces to it in order to kind of solve that problem. But yeah, I think we're going to come together at some point. I don't know when that's going to happen, but there's a lot of exciting things happening in the healthcare space where people are working on things to make them better.
Yeah, and we have, and this isn't my area, right? I'm in the health technology and especially the AI part of it. Within Inflect Health, there's another part where we have a team that innovates around delivery models and has a direct-to-consumer primary care. And it's amazing. Like, I'm a member of a direct primary care clinic, and I pay less than my deductible is, right? And I still pay insurance. So it's like I pay for insurance and then I don't use it to see a primary care doctor because it's actually cheaper for me to pay out of pocket to get much higher level care, right? That's just a weird system.
Yeah, it is a weird system. Not always conducive to the patient.
Right.
Yeah, it's
on it. And then in this case, the weird part is like it's out of pocket spending for me that's cheaper than if I went to my in-network doctor.
Mhm.
And I have appointments whenever I need them. And right, it's weird. Like that, how can the system support that? Right, that's broken. Anyway.
Yeah, no, that's a wonderful insight, and thank you for your time today. We're at the end of the podcast, but again, I just want to thank you for your time, and then just for our viewers, where can they find you at? Where's a good place to connect, like social media and your website?
Yeah, so I'm on LinkedIn. I don't think there are very many Tamayo Sarvers out there, so that works. And then inflect.health.
Thank you. I appreciate it.
Inflect.health is where you can find Inflect, and Vituity is Vituity, Vituity.
Excellent. Well, thank you for being on the Smarter Systems Better Care podcast, and appreciate your time today. Thank you very much.
Thank you so much for having me. I appreciate it. It was
Absolutely.
nice talking with you.